Hello everybody, welcome back to Bread and Butter Primary Care with Dr. Stokes. Today we're going to be doing a video on diabetes. This video is entitled Diabetic Ketoacidosis, DKA. What is it and why do we care? So we've talked a lot about the management of diabetes, the diagnosis of diabetes in terms like in the long term. We've talked about the risks of diabetes in the long term, that having all that extra sugar increases your risk of heart attacks, strokes, and poor health outcomes in the future. So today we're going to be talking about DKA, which is what happens to a person if their sugar is acutely too high. So this is a short-term, immediate type of a problem because of hyperglycemia or high sugars in the blood. And there's some somewhat complicated reasons for why DKA develops. And so we're going to talk a little bit in this video about how it develops and what types of patients get DKA, why it happens. There's a big difference in how this presents in type 1 diabetics and type 2 diabetics, and we'll talk more about that. So DKA is diabetic ketoacidosis. So in short, it is the increase in keto acids in a person's blood. And the human body is set up to operate on a very narrow pH window. And so you can't have too much acid in the blood and you can't have too much base without there being major changes in how the cells function. And so if you have a process happening that leads to the buildup of acids, that will lower the pH and that will cause cellular malfunction, and same the other direction. And so what happens, the end problem in DKA, just like the name would say, ketoacidosis, is the buildup of keto acids causing the body to go into acidosis, which then interrupts the function of the body and can lead to death if it's not taken care of. So we're going to kind of work backwards and then kind of put this all together. So the problem is there's a buildup of acids, keto acids. So where do those come from? For the most part, keto acids are a byproduct of fat breakdown in order to get sugar. So there's three main sources that the body uses, and this is some oversimplification, but three main sources the body uses in order to have the sugar it needs. The body has to have glucose. That's the energy source for the development of energy that all of our cells use. It will do pretty much anything it can to get the glucose or the sugar that it needs to function. And there's three main places we get sugar. We eat it, our liver stores it as a glycogen, so it's kind of like a short-term storage, and then our fat is a long-term storage. So those are the three sources. So we can eat sugar. If we don't eat sugar, then our liver will break down glycogen to give us sugar. If we run out of that, then our metabolism will break down our fat to give us sugar. If we get to the point that you're doing the fat breakdown part, one of the resultant molecules is keto acids. And so diabetic ketoacidosis is when the fat stores are being broken down in order to get sugar, leading to an excessive amount of keto acids, which then makes the body go into an acidosis, which is then dangerous for the cellular function. So that's what happens. So now let's talk about why. Why does that develop? For example, a normal person never has that happen. Why does it happen in a diabetic person? And the answer lies in the function of insulin in the body. Insulin is famous for moving sugar from the blood into the cells. That's kind of the main function we always think about. We've talked about in our other videos already. But it does a lot of other things. And a lot of the things that insulin does is also aimed at lowering the blood sugar level. So in a person, as far as like sugar metabolism, what happens is, let's say you get up in the morning, and we're going to talk about a normal person who does not have diabetes. So you get up in the morning, you've been sleeping for 8 hours. So you don't have any sugar in your blood from what you've eaten. You're kind of in a state of fasting. At that point, most likely you're getting most of the glucose from your blood from the liver. So the liver has a whole bunch of glucose strung together in these molecules called glycogen You wake up, you're in a fasting state, so you're breaking down the glycogen to keep your sugar levels up. You're breaking down some fat to keep the sugar levels up. You get up out of bed and you go eat a nice bowl of Captain Crunch, right? So now there's plenty of sugar in the blood, and so as the sugar goes into the blood, the pancreas gets that sugar and says, "Whoop, we got lots of sugar. Let's get some insulin out there." So there's lots of sugar. The pancreas recognizes that, pumps out some insulin, and insulin does 3 different things to shut down that sugar level. It takes the sugar and puts it into the muscles and skeletal muscles and things. We've already talked about that. It tells the liver, don't break down glycogen, stop putting sugar in the blood, and it tells the metabolism, let's not break down fats right now. So insulin actually shuts down all 3 sugar sources. The sugar we've eaten is put into cells. The glycogen from the liver is told to stop doing that, and the fat breakdown is told to stop as well. Insulin does all 3 of those things. Okay, so now let's imagine a person who has type 1 diabetes. And remember, type 1 diabetics do not have any insulin. Okay, their pancreas does not function. It doesn't make insulin. So a type 1 diabetic wakes up in the morning and they haven't eaten. And so they have a certain amount of sugar in their blood. Let's say they go have a bowl of Captain Crunch for breakfast. Their sugar goes way up. Their pancreas isn't working. So nothing recognizes that the sugar is high. There is no insulin coming out. And so you have this high amount of sugar in the blood. Since there's no insulin, the sugar cannot get into the cells to be used in order to make energy. So the body thinks it's in a sugar deficient state because there's no way to get the sugar from the blood into the tissues. And so the body's like, we don't have glucose, we can't make energy. And so it actually revs up the processes to put more sugar in the blood. So the liver breakdown of glycogen increases because insulin's not there to stop it. Remember, the normal person, insulin came up and it stopped the liver from doing that. Well, there is no insulin. And so the liver's pumping out the sugar. The fat destruction, the fat metabolism, there's nothing to stop it. There's no insulin. And so you just ate a bunch of sugar. Your liver is pumping it out. You're breaking down fat in order to get it. And what happens when you have uninhibited breakdown of fat? You get ketoacids. Because remember, that's where ketoacids come from. They're a byproduct of fat metabolism. So usually in a normal person, insulin will appear and it will tell the body, don't break down fat. We don't need it because there's lots of sugar in the blood. Without that messenger, without insulin there, there's no one to tell the body to stop breaking fat down. So it just goes hog wild and it's breaking down fat, breaking down fat, breaking down fat, breaking down fat. And as it does so, you get these ketoacids that build up, build up, build up, build up. If you get enough ketoacids in the blood, you actually become acidotic. Your cells stop functioning. You start getting massive amounts of edema. That edema can also occur in the brain. You can go into a coma. You become obtunded. You become unresponsive. And if nothing happens, then the patient could die. So that's, in short, how ketoacidosis develops. So the key things to remember is DKA, diabetic ketoacidosis, is mainly a result of a lack of insulin. Now, glucagon is in this game too. I wasn't going to talk about that at all in this video. It doesn't play as much a part in it, and it's not used all that much as far as treating it. And so remember that insulin not only moves the blood into the cells, but it also tells the liver to stop breaking down glycogen. It tells the body to stop breaking down fat. And it's the lack of those inhibitions that lead to ketoacidosis because there's nothing to tell the body to stop breaking down fat, so it just does it like crazy. Ketoacids build up in the blood and the patient becomes acidotic, and that's a problem. So there's going to be some more videos about what happens in type 2 diabetics when this type of system occurs and why it's different. And then what you do if you find that this is happening to one of your patients. So I hope that's helpful. Have a great night. This is Dr. Stokes for Bread and Butter Primary Care.